Hello, everyone. My name is Ebony Funches, and today I will be presenting the Integrative Psychotherapy NURU 642 video. In this case, I have a 37-year-old African American female who lives alone. She is unmarried without any children. She works as a retail manager. Patient reports that her mother has a history of psychiatric treatment for depression and anxiety, and that her father suffered from bipolar disorder and had been receiving psychiatric treatment. Her father was hospitalized on multiple occasions for manic episodes during the previous years for serious psychiatric symptoms of his disease. The client stated to me over the phone that she's been having crying spells, felt sad all the time, had trouble sleeping at night, and was not hungry most days. She stated that she thought that her depression worsened since the inception of the COVID-19 pandemic, and most recently with all the protests going on from the Black Lives Matter movement. Things have just been declining. She has acknowledged that the depression has affected her life in a number of ways. For one, socially, she's been keeping away from friends and family events. Occupationally, she's been written up multiple times this month for poor performance at work, which she never had a problem with in the past. She presented with the following symptoms present for the past month: depressed mood, frequent sadness and crying, decreased appetite, feelings of guilt, low self concept, fatigue, irritability, insomnia, hopelessness, and difficulty concentrating. She denies any past history of suicidal attempts or threats. Recent urine toxicology in our office were all negative for illicit substances, and she denies any recent use of illicit substances. No family history of suicidal attempts or threats. And in addition, she presented with difficulties in her interpersonal relationships, persistent negative thoughts about her appearance and work performance abilities. As well, she did say that she had some guilt regarding the current events surrounding George Floyd's death and heightened awareness of racial inequality. I asked her to explain this, and she basically said that, with everything going on in her life and her mood, that she felt like she wasn't doing enough for solidarity in the Black community. Being an African American female, she felt that she wasn't advocating enough and, protesting enough um, to be able to help make some change with what's going on. The patient's medical history revealed that she suffered from asthma, which is well controlled. She uses eyeglasses for refractive error, and that in the past she was overweight, not so much currently. Historical information revealed that she had been previously diagnosed with major depressive disorder 3 years ago and was intermittently treated for 3 years with supportive psychotherapy and antidepressants, fluoxetine and sertraline, and there's no dosage information available. The first episode was triggered by rejection from a boy from whom she had romantic feelings for, and her most recent episode appeared to be related to the social isolation and quarantine required for the COVID-19 pandemic and current Black Lives Matter movement. The first psychotherapeutic modality that I chose for this client is actually a solution focused brief therapy. This was preferred to start with because it's a collaborative process. It doesn't require a lot of time, it's also evidence based. It doesn't require a lot of historical information. So it's a great way to set goals with your client early on without evoking a lot of emotions. Solution focused brief therapy is goal directed. It's a collaborative approach to psychotherapeutic change that is conducted through direct observation of the client's responses to a series of precisely constructed questions. So I am going to start with what we call in psychiatry the miracle questions. And it gets the client to largely focus on the desired changes for their immediate future. The way this is done, as you'll see in the video demonstration, is you ask the client, suppose that one night there's a miracle that happens while you were sleeping and the problem that brought you to therapy is solved. How would you know? What will you notice difference the next morning that will tell you there's been a miracle? And you have to be very precise with the tone of your voice, the way you ask this, because it is a therapeutic modality. And culturally, I thought this would be great for my client who's African American, because as you know, they're often very reluctant to receive psychotherapy. So this is a good way to establish a therapeutic alliance, some rapport, some trust, and some openness to the idea of therapy, in hopes of getting the patient to accept more, I would say, emotionally evoking therapeutic modalities. The next psychotherapeutic treatment modality that I've chosen for my client is cognitive restructuring. She mentioned at the end of our last session that she went online and did a schemas quiz and found out that she scored extremely high in the schema of perfectionism. She said that she often sets really high standards for others and including herself. And so that's why she's really been socially withdrawn and not engaging in social activities with family and friends because she's just simply disappointed in them. And she wanted to work on that. And so I thought cognitive restructuring would be great for her problem. It refers to the process of challenging, changing irrational thoughts. Specifically, I was going to use Socratic questioning because it's something that's evidence-based and very effective. It's a technique basically therapists can easily do by verbally asking and probing questions about the client's irrational thoughts. Clients work to improve their awareness of these irrational thoughts so that they can begin to consciously question their own thoughts. This is often very hard with African American clients because they're reluctant and with the stigmas associated behind mental health. The therapist may have to tweak this particular modality by having the clients question the helpfulness of their thoughts rather than just deeming them irrational or not valid. You also may have to bring religion into this, and also you may have to accept some of the client's core beliefs if they are in fact cultural. Also, another way is to make sure that the homework that you assign is culturally congruent in collaboration with the client. Works really well. So for the purpose of that exercise, I'm going to have the client fill out this worksheet. It's Socratic questioning. And I'm going to have her, as a collaborative process, fill this out the week prior, and we're going to review it. The third and final psychotherapeutic treatment modality that I've chosen for this client and her issues is the Gestalt therapy. Gestalt therapy, as you know, is a humanistic therapy, and it focuses on the holistic view that people are intricately linked to and influenced by their environments, and that people strive toward growth and balance. So it is a very client-centered, whole person type of psychotherapy. And Gestalt therapy places emphasis on gaining awareness of the present moment and the present context. So it's focused on the here and now. It's chosen to help this patient discover emotions that caused the first episode of her depression when she was rejected by a boy. and whom she had romantic feelings for. So this seemed like a significant event in her life, and it doesn't sound like she was able to process those emotions. So I was going to use the exercise of the empty chair gestalt therapy, where the client is going to talk to that boy um, face to face in an empty chair, and just ask to imagine that person is sitting in that chair to be able to try to get some insight and evoke some emotions. As far as culturally goes, this is really hard in the African American male population because they're often this type of modality can often evoke a lot of emotions, and as a culture they're taught to be strong and to not cry and to not show emotion, so that could be a barrier. It could be useful in patients who are not multicultural, and who are more open to therapy and see that emotions are okay. So that may be someone who may not be very culturally diverse. Overall, I expect the discussion to go extremely well with the client. Over the phone, she seemed very open, and I'm hoping that these three modalities, the way I plan to mesh them, work to establish a therapeutic alliance and to establish some type of rapport with this client, and also to establish a good, effective patient provider relationship that is trustworthy. I really hope that I am able to help the patient to realize that some of her thoughts may be irrational and may be holding her back, and just to gain some heightened awareness, and also to give herself some credit and help improve her overall functioning at work and socially. Hi, thanks for waiting.
Hi, thank you for having me.
So I just have to ask you one question first and get your verbal consent. Do you understand and give consent for these sessions to be video and audio taped and be submitted to Brandman University?
Yes.
Thank you. So I know this is our first time meeting in person, but we've had several telehealth sessions over the phone. So I feel like I know a little bit more about you each time we talk over the phone, but I actually wanted to bring you into the office today so we could talk more about your the things you described to me. You know, you told me that you've been not really wanting to eat, not going to a lot of functions with your family, feeling down and depressed, crying all the time. And, you know, I really wanted to bring you in so we can start doing some goal setting. I'm not really sure what that looks like for you and what your goals are. So, I mean, with that being said, I wanted to ask you if what we call in psychiatry the miracle question. If, you know, one day you were to go to sleep and you were to wake up and a miracle happened and all your problems were miraculously solved, how would you know?
I would know because I would be able to spend more time with my family. I wouldn't be as sad. I would have a better career. I would be able to spend more time with my friends. You know, there's a lot of things going on in the world right now that I feel, guilty about sometimes. So I think I would feel less guilty.
Mm-hmm. What will you notice different that next morning after that miracle happened in your sleep?
I would just have a sense of peace, being at ease. Most mornings when you wake up, you look at your phone, you're all scowling at everything you see. I probably would be less inept to do that.
Mm-hmm. Can you elaborate on your phone and how that would actually tell you that there's been a miracle?
You wouldn't see as much bad stuff. Maybe everything in the world would, go back to calm and peace. But right now we have just such a state of chaos.
Mm-hmm.
Everything's everywhere.
Yeah, it sounds like that's really difficult for you just to even just turn on your phone on social media and see what's going on. It doesn't seem like you can really escape some of the sadness that's going on in the world. But I mean, there's lots of people who feel the same way that you feel. So I'm really hoping that I can continue to help you sort out some of these thoughts that you're having, and really look forward to your own miracle, us getting to that, and hopefully solving a miracle in your life. It may not happen right away, but we'll get there. So I'm looking forward to working with you.
Likewise. Thank you.
Hi, welcome back. Thanks for waiting again. It was a busy day today. How are you?
I'm doing good. Here is my homework assignment you had me complete.
First off, before we get started on this, how are you feeling since last week when we had, that face-to-face session?
So far so good. I got a chance to really think about, maybe I don't get up in the morning and look at my phone, get some breakfast, have a better outlook on the day, so that way I'm prepared to get through the day.
Okay, that sounds good. Glad to hear that. So, thank you for doing your homework. Um, I think today we will do a little bit of different type of psychotherapy. We call it cognitive behavioral therapy because cognitive meaning your thoughts control your behavior and the way your emotions. So we call it a triangle actually. So the way you think controls the way you feel, which controls the way you behave. So you put on here a thought to be questioned is I must be perfect or no one will love me. I know you identified perfectionism as a core belief. Can you elaborate a little bit more on that? Like what kind of evidence you have that you must be perfect for someone to love you?
Well, I feel like that's the best way to get the love. I'm not feeling any love, so obviously I must not be perfect. I feel that the people who are getting the love obviously are perfect.
Okay. What are you basing that on? Facts or feelings?
Probably a little bit of both, more so facts. Just looking at how I see other people's situations, I tend to compare a little bit.
Hmm. Okay. Is it something that's black and white?
It's very black and white.
Okay. Do you feel like you could be, is there another way that you could look at this? Or you might be misinterpreting this?
No, there's most definitely a separate way I could look at this.
How could you look at that differently?
It could be, just from someone else's point of view to get someone else's example of what they're going through.
Hmm. Okay. And could your thought be an exaggeration of what's true?
It very well could be. It could.
In what way?
In that you don't necessarily have to be perfect, but it would help.
Okay. All right. Are you think you're having this thought out of habit or do facts support it?
Probably more so facts, a little bit of habit.
Okay. Okay. And did someone pass this thought along in some point in your life?
It's just come to this conclusion on my own.
Okay. Okay, very good. Hi, welcome back. I know.
Hi. Hello, Dr. Bunches.
Hi. I know that we last spoke a week ago at your last session. Just wanted to check and see how you're feeling now.
It felt good to do the exercises. I think that really gave me some perspective on, some of the goals that we need to set for my life. So I feel a lot better. Thank you.
I'm glad. So today I'd like to do a very different exercise. I know that your first episode that caused you to feel down and depressed was when you got rejected, back in high school with someone you really had romantic feelings for. So I want to focus on the here and now and anything you may have forgotten. I want that to kind of help you, to recall some of the events. So if that boy that rejected you was in that chair, what would you say to him? What would the dialogue be like? So I want you to role play that he's sitting in that chair over there.
Well, I would think that the boy there would need to know the woman that I am now is okay. He would probably say, he never meant to hurt me, and that just wasn't his plan in life, and we all had different decisions to make, and he had to make his decisions, and of course, I would, you know, just want to tell him like, I'm gonna be fine, and you're gonna be fine, but all the extra stuff is just unnecessary. I think that would be the only thing I would need to get out.
He's right there. I want you to actually talk to him.
Well, I'm fine. I'm gonna grow up to be a wonderful human being. Many of people are gonna want me, and you'll probably circle back around.
Very good. How did that feel to get that off your chest?
Felt good. Felt real good.
Very good. We'll continue to work together. I think that we've, over the course of the past 3 weeks, I've seen a lot of progress. We did various therapies. We did cognitive behavioral therapy where we focus on some thoughts that may be irrational and may be causing you to feel, you know, the way you don't want to feel that you told me. We set some goals initially and some solutions with the miracle question. Um, and then finally, we were able to do a little role playing with some humanistic therapy that we call Gestalt therapy, um, the empty chair technique. And you were able to get a lot off your chest that you weren't able to tell that gentleman that caused you to feel inferior in the past. So I'm looking forward to continuing to work with you on a weekly basis. And I'm glad that that you're really feeling better and that you're performing a lot better at work and starting to get out a lot more.